this, I think. I'm at work, by the way. All the equipment behind me is the inventory stuff that I manage with my company that I work for. But what I wanted to say today was, every now and then with my hernia, it feels great. Like it's never really painful. I never feel restricted. I never feel like it's wrong or it's bad. But I know mine was big. I mean, the hole in mine was like this big, he said. And he said he had to use a pretty big piece of mesh. And I remember before I had surgery, it started hurting because the muscles, my ab muscles, were being pulled apart one way and the other, split of the middle. And I remember asking him, I said, "Are you going to sew those back together?" And he said, "No, I'm going to leave them where God intended them to be," which was kind of a funny comment to me, because I'm like, well, if we were going to intend to leave everything the way God intended it for it to be, then I wouldn't be having surgery. I would just either heal or my guts would fall out. So there is a little bit of, some doctors have the right to go in there and do stuff. But anyways, he didn't seem like it was a big deal. And what's weird now is that I have this spot, like my belly button is in, I'll show you in a minute, but then my belly button's in one spot, and I want to say a good 1.5 to 2 inches above it. It feels really, I guess that's where my muscles have been split, because it feels less dense there. And sometimes if I press in on that with 2 fingers, I can feel weird stuff that I don't feel everywhere else. Like I press everywhere around it and it feels kind of, more resistance, and I push there and there's way less resistance. So it could be where my muscles have split and gone along either side of that area in the middle. But it sometimes, every now and then, it'll give me a little bit of pain, like not crazy pain, but it'll catch and I'll feel it and take notice of it, and I'm aware of it. But what I was going to say is that I really didn't get a clarification. Like I didn't see any footage, or he didn't come in and say, well, this is where your hole started in your abdomen and it stretches from here to here. So I don't know exactly 100% where the hole is. I just have a general idea. I would suggest that if you have surgery and you're curious, just so that you can keep up with it in the future, if an issue comes up, that you ask your surgeon where it is. Like I'm thinking about making a follow-up appointment with him so that I can have him kind of point on my stomach and say, my hole started here, it stopped there, and stuff like that. It would be a good idea to know that stuff, so that whenever you feel pain underneath, or even a catch or anything, you have a good visualization of what's going on in there. And since he's the only person who saw in there, other than the assistants, I'm just speculating. I can go by what I feel, and I can go by what my fingers kind of feel, like what I feel internally and then what my fingers feel externally, but I'm not 100% certain. So I'm going to show you a little bit. So my belly button is here, and again, I'm at work, or I'd pull my shirt up, but my belly button is here, and right about in this area, here's the scar of you've seen my videos before, right about in this area, above it, a good this far above it, is where I get that weird feeling. And it's slightly painful if I push on it, but very, very slightly, extremely tolerable. But I'm wondering if I had weight, if I was doing a squat or doing something that pushed a lot, if it would really hurt. I've not had anything to indicate that that's true, but I do want to find out. I do want to go to the doctor and ask him, give me an outline of where the stuff exactly is, so that I can kind of know. But I'm pretty sure that my muscles stop there and then are veered off on either side of that hole. Anyways, food for thought. There's an update. My tip is ask your surgeon either the day after or your next follow-up appointment, which I didn't even think about it, to completely point out on the external where the holes are, how big it is, so that you kind of have a good visualization of where it's at. Have a great one.